As administrator of DEA, when this goes back 40 years, I'd get petitions to change it to Schedule 2 or 3. And we would ask the FDA, what are your opinions on marijuana as a legitimate medicine? And since that time, even to this day, it has ruled that marijuana is not safe or effective medicine, that the side effects outweigh any benefits from taking the medication or smoking it. I don't think the FDA has ever approved a smoking product for medicinal purposes. I wouldn't say marijuana is as dangerous as heroin. I wouldn't say it's as dangerous as some of the legal drugs that are Schedule 2, but it's not safe or effective for medical use according to the Food and Drug Administration. And that's the validator of medicines. When we go into drugstores, you and I, whether it's over the counter or to the pharmacy, those products have had FDA review, whether it's aspirin or Oxycontin. The veterans are a special population because they probably have a lot of post-traumatic stress. They may have injuries. They're not youngsters. Most of them will be in their 30s and some in their 40s and 50s that have done a whole career in the armed forces. And some of them have had anecdotal experience, positive anecdotal experience with smoked marijuana. That doesn't mean that I think they should get a blank check at the VA for giving out whatever marijuana they want at all. It's a very tricky question because in a VA hospital, they may be in a state which has legalized medical marijuana. They may be in a state which even has legalized recreational marijuana, of which there are 8 states in the District of Columbia. But the VA is run by the federal government. And it's against the federal law to use, possess, or sell marijuana today. Someone like me would say, actually, they're protected. Because some of us don't think marijuana is good medicine. So you could take the position they're second-class citizens because they can't have access to it, or you could say because they are under a federal jurisdiction, they're protected from it. Anecdotal information is not the basis to change the laws or make medicines available. It's got to be based on science. To them, personally, though, they seem to think they found a fix or a way to ease their pain. I think if they went to a couple of different doctors, maybe even looked at therapeutic and herbal remedies, maybe CBD oil instead of smoking pot, maybe Marinol instead of smoking marijuana, maybe other medications that are, if not in pill form, analgesics that are available in herbal and dietary situations. It's not easy. I'm not trying to say there's an easy answer for a vet that has had some success. But I would caution that person that their ability to drive and function and their impact on the lungs is going to be affected. The VA will hear pressure from Congress and pressure from some vets. Whether the administration wants to listen to the FDA and follow its advice remains to be seen.